Good afternoon, Miamians. I'm Molly Young from the Miami University Alumni Association. And today, as part of our webinar series, we present the causes and consequences of athlete burnout. Joining us today is Dr. Christine Pacewicz. She is in our sorry, I always do that. I throw myself off. We talked about getting thrown off. She's from our sports leadership and management department within the School of Education, Health, and Society. So welcome to you, Christine. Now that I've made my way through that awkward opening, thank you so much for being with us today.
Yeah, thanks for having me.
Of course. And just a reminder for our live viewers, you can submit questions for Dr. Pacewicz to answer throughout the webinar today, comments or feedback. So please use the Ask a Question button underneath your video. And with that, I'm going to turn it over to you to get us started. Welcome again and thank you.
Yeah. All right. Hi, everyone. Again, I'm Christine Pacewicz, and thank you for joining the webinar today. I'm going to speak about one of my main research areas, which is athlete burnout. And I study athlete burnout because it's a marker of ill-being in our athletes, and we know that it's linked to decreased engagement in sport. If we think about that with respect to youth sports, youth sports is our primary way for kids to be active. So that's a problem if we see them decrease their engagement in activity. And we also know that it's linked to other health indices that I'll talk about later in my presentation. So, let's see. There we go. Okay, so I want to give you an outline for our webinar. I'm going to first define athlete burnout. I've noticed that burnout seems to be a buzzword these days. So I want us to make sure that we're all on the same page for our definition of athlete burnout. I'll then talk about causes of burnout. I know we had some early questions about this. And learning about causes of burnout will help us then understand early warning signs and what to look out for with respect to athlete burnout. I'll then transition to what are some consequences that occur if we don't mitigate our risk for burnout or reduce burnout perceptions. And then I'll end talking about ways in which we can try to mitigate risk, both at the individual level, so for athletes, and then if we're thinking about coaches, how can coaches implement things with their team to help reduce burnout? So first off, athlete burnout is a cognitive affective syndrome. So that means that it's part of our thoughts and our feelings. And it's characterized by three core symptoms. This includes exhaustion, both mentally and physically. And so that's a really key component, is especially when we think about sport. So in sport, we're inherently going to be physically tired at some point, especially if we're following periodized training. And that means we'll ramp up and overload in our training for a period of time, and then we see a decrease in that overload to helpfully have us adapt. So if you think about if you lift weights, you're going to be increasing your weight for a period of time, then you're going to reduce your activity so that you can adapt to that overload. So we have to consider both physical and mental exhaustion when we're thinking about burnout. Our second characteristic is reduced accomplishment. So this means that we perceive that we are not accomplishing as much in sport as we think we should. We see a decrease in our performance or we have inefficacy in sport. And then our third dimension or symptom is sport devaluation. And so this means that we become more cynical towards sport. We see a change in one's attitude toward their sport. We begin to devalue it. We might skip practice. We place less importance on sport. And so later on in my talk, I'll discuss how we see these symptoms change with time, but we tend to see that these symptoms increase across the season. So a common question that I usually get since I study burnout is what's the prevalence of burnout? And there's actually not an exact answer to that question. Some research will tell you or say that we can expect maybe 7 to 11% of athletes to experience burnout at some point in their career. But this is a guess because we have no epidemiological studies on the prevalence of burnout. This means we haven't done large-scale population-based studies to help us understand who is suffering from burnout. And this is also hampered because we don't really have a clinical threshold for burnout. So if you think about healthcare, we have a clinical level where we know if we have high blood pressure. We can go in and get diagnosed with clinical depression because there's these symptoms that we can evaluate, and there's a clinical threshold. And unfortunately, though there's quite a bit of uptick in research on burnout, we still don't have these clinical thresholds, and we haven't done epidemiological studies. But what we have seen is that our scores in reduced accomplishment and evaluation have increased in the last 20 years. And this is across youth and young adults. And so we've seen that reduced accomplishment, or that we perceive we're not doing as well in sport, has increased, and so has sport devaluation. So with that, now that we know our core definition of burnout, I want to talk about some of our main causes of athlete burnout. So I'm going to talk about physical, psychological, and social causes of burnout. These are not all encompassing, but these are some of the primary causes that we have seen consistently linked to burnout in research, and they're guided by our theoretical perspectives when we study burnout. So the first cause that we often study and we've talked about is physical training. And something I should say is that burnout is highly individual. So if you're listening and seeing all these listed causes, for some individuals, these will not lead to burnout, but for others, they will. So it's highly, highly individual. We do know that if we don't adapt to physical training, if we don't have adequate rest and recovery after physical training, this can lead to burnout. So overtraining and the symptoms of overtraining are highly tied to burnout. So this means that we're not recovering even with rest. We are stale, so we're not performing well, and this can contribute to burnout. And some of our research has shown that there's like a physical strain for burnout, and then there's a psychological and more social strain. And so the first cause, that physical training, can be thought of as like that first strain of burnout. We also have seen in longitudinal work that lack of sleep or disturbance to sleep can contribute to burnout. And this is likely because sleep is a way that helps us recover. And so if we have disturbed sleep, then we're not going to sleep as well and we won't recover. Another leading contributor to athlete burnout is chronic stress. And this is more than just training stress. So if we're thinking about athletes, it's all the stressors that they may face. It's in academics, it's social relationships, maybe it's relationship with parents and coaches. And if we don't have the resources to cope with these demands placed on us, then we see that the stress response is then linked to burnout. Additionally, we know that the context of sport or the structure of sport can also contribute to burnout perceptions. Specifically, we've seen more of a professionalization of sport, and I'll come back to that idea for youth. But with this focus on specialization, we're seeing that more athletes have a unidimensional identity. So that means I see myself as an athlete, and that is who I am. And so if I have a unidimensional identity, coupled with feelings of lack of autonomy, because when I'm in my sport, I usually have very few choices I get to make because my coach is largely going to dictate what I'm doing. Those two combined can contribute to then feeling entrapped in sport. So I am an athlete and I have nothing else that I can do. So I have to stay in sport. I have to stay in sport because I've invested a lot of time. My parents have invested a lot of money. Perhaps I feel pressure from coaches or teammates to stay in sport, even if I might want to try out another sport, or perhaps I want to leave my sport altogether and participate and do something else. And so we see these shifts in identity and perceptions of lack of autonomy or control over what I'm doing can make us feel like we are entrapped in sport. Another component for unidimensional identity that we want to think about is if I solely identify as an athlete and then I get injured, we see that then reactions to injury can be worse because that piece of who I am or all of who I am is now taken away. So just something to also think about. So outside of just unidimensional identity impacting burnout can also impact how I react to an injury. We also see that if our motivation impacts or can contribute to athlete burnout. So some people say burnout is motivation gone awry. So if we participate based upon external reasons, so I have to be here because my parents told me to, they want me to get a scholarship, I like the money that I receive or the NIL endorsements that I get. Those external reasons means that we have more extrinsic forms of motivation, which are shown to then contribute to burnout or increase our risk to burnout. And then finally, one personality trait that has been linked to burnout over and over again is perfectionism. So perfectionism is marked by concerns over mistakes and fear of failure, coupled with setting very high standards for oneself. And so we've seen that if someone's a perfectionist, they're more likely to experience burnout. So these are physical and psychological causes of burnout. And in the last 10 or so years, we began to focus more on the social side of burnout. Early on, we did study like coaches and parents, and my research has largely focused on teammates. And so I'll save that for a little bit from now. So first off, with regard to like the social context of sport, we've seen that the professionalization of youth sport, which entails high intense training, feeling the need to be in academies and clubs, less free play, we specialize early. That those are characteristics of what we mean by the professionalization of youth sport. Otherwise, youth sport has begun to look more like a professional sport. So that structure places more expectations and pressure on our youth. And that, coupled with year-round training and not having adequate rest, can contribute to burnout. We've also seen that perceptions of lack of social support from people in general and from coaches and teammates can contribute to burnout. And this means perception. So you might be providing social support to your child, to your athlete, or they might be getting social support from a teammate, but if it's not perceived as the support they need, then it doesn't really count. So it's that perception that's most important. And then we also know that coach-athlete relationships and interactions with our athletes directly contribute to burnout. And so we more authoritarian coaching is linked to burnout, meaning we use punishment more often, we use more controlling behaviors, we give less autonomy, support to our athletes. Those behaviors are then increasing our risk for burnout. We also know that climates that are focused on solely winning can increase risk for burnout. And of course, there is a place for winning in sport, but there's also a place to help us focus on mastery and improvement. And we'll come back to that when we talk about strategies to help reduce burnout. So I'm going to then talk about a newer area, which is my area of research, that's really focused on teammates and how teammates contribute to athlete burnout. And so my research has focused on interactions with teammates and how communication might foster burnout perceptions. And so I'm going to share with you one new study that just came out, and then we'll talk about the impact of social media on burnout perceptions. So work within teachers has examined contagion and burnout. And what this research has shown us is that teachers can transmit burnout cues or messages to fellow teachers, and that they also can experience greater burnout if they talked to colleagues that were burnt out earlier in the season. And so this made us wonder if burnout is contagious, similar to how like moods can be contagious, via communication with one's teammates, because we know that with athletes, they talk a lot to their teammates and they spend a lot of time with their teammates. So we conducted a study looking at adolescent baseball and softball athletes. We had 176 athletes from 15 different teams. We examined their communication with their teammates and as well as some social perception and their burnout. So what I'm first going to show you on this screen is our networks of our teams. I'm showing this because I think it's really cool and it helps you see how our athletes are connected. So again, we had 15 teams that were baseball and softball adolescent athletes. They were high school athletes. And each network represents a team. And so the lines are actually arrows, and they indicate how our athletes are connected to each other. And the circles or nodes represent individual athletes. So you can see that there's a lot of lines, which is good. This because we asked athletes to tell us how often they talk to each of their teammates at practice. So this means that our athletes are talking a lot at practice. It's good. It could be bad. It depends upon what they're talking about. A darker arrow indicates that they communicated with a teammate more, and a lighter arrow indicates that they talk to that individual less. A smaller node represents an individual who had lower burnout at time point 1, and that was at the middle of the season. And a black node or a black circle represents an athlete who saw a significant increase in their burnout at our second time point, which was at the end of the season, but before the conference championship or the wrap up of the season. So this is not a statistical analysis. It just allows us to look at the structure of our teams and to observe what is going on. And you can probably see that our team in the upper side of the circle has many athletes who saw an increase in burnout. And so we could theorize that perhaps via communication, perhaps burnout spread among these individuals. We could also then look at their training and their coach environment, but we didn't do that. So again, this just lets us look at the structure of our teams and to see what's going on and how are people connected. So then to understand contagion, we ran multiple regression analyses. And so what I'm showing you is that we wanted to assess after we controlled for burnout at time point 1. So in other words, if I was one of those athletes, we were controlling for my burnout at time point 1, and we wanted to see if exposure to my teammates' burnout predicted burnout later in the season at time point 2. And so after we controlled for burnout at time point 1, we found that the exposure term, which means it was my communication with my teammates and multiplied. So my communication multiplied by their burnout. There was a significant effect. And so that tells us that if I communicated more with my teammates and they had greater burnout at time point 1, then I had an increase in burnout at time point 2. So that tells us that there's initial evidence for the contagion of burnout. This is one study, and so we have to replicate this again. But it does leave us with a key implication that we need to monitor communication among teammates because it might foster burnout contagion amongst a team. We also looked at loneliness. This stems from past work of mine that was mostly cross-sectional. We did find that perceptions of loneliness were linked to burnout. So if I experienced more loneliness at time point 1 or in the middle of the season, then I also experienced greater burnout at time point 2. And so this then helps us see that there's psychological and social components that are contributing to burnout. So that's my most recent work looking at interactions with teammates. And another factor that we've begun to study with regard to athlete burnout is social media. And so this work stems from early burnout work that found that two main stressors of two stressors that contributed to burnout included the media and public pressure. However, we've seen that media's presence and sources of public pressure have changed, especially with the increase in use of social networking sites. So these include Facebook, Instagram, TikTok, and Twitter. So the study that I'm going to talk to you about today focuses on Instagram. We know that the most common user of Instagram is aged 18 to 35 years. And athletes report commonly using Instagram. And this is why we chose Instagram. Athletes say that they use Instagram for self-presentation reasons, to market themselves, to communicate with their fans, their teammates, their coaches, and to connect with others. And then they also share pictures of themselves and their results. And we also know that people tend to socially compare themselves to others when they're presented with information about other people's performances. And so this work was guided by social comparison theory to help us understand if this change or shift in media with the use of social media is a contributor to burnout, and if social comparison via Instagram might also help us understand burnout perceptions. So this study was done in collegiate athletes because we know that collegiate athletes fall in the age range of the most popular users of Instagram. And so I'm just going to present a little bit of the results that we found. So what we found was that time spent on Instagram was positively linked to perceptions of exhaustion and reduced accomplishment by way of browsing. So what that means in general is that if an athlete spent more time on Instagram and they were browsing, I think people now say like the doom scroll. So you're browsing on Instagram, then those athletes would have higher perceptions of exhaustion and higher perceptions of a lack of accomplishment in their sport. So this led us to one big conclusion of that we need to be aware of the toll of the scroll because it seems that browsing, that process of browsing or that action is what might contribute to perceptions of burnout. We did find that link between time browsing and exhaustion was interesting because some athletes report using social media or technology to help them relax. But if we are using it at night, it might actually impact our sleep. And coupled with then seeing other people's performances might then lead to poor recovery and more exhaustion, and then also perceptions that I'm not doing as well compared to others. Interestingly, though, we did find direct effects with from social comparison and our burnout symptoms as well. So we found that social comparison using Instagram, so comparisons made about ourselves toward others, was linked to reduced accomplishment and sport evaluation. So if I compared myself less favorably to people on Instagram, then I had higher perceptions that I was not doing well in sport and higher devaluation in my sport. So what this tells us is that the process of social comparison on social media, specifically Instagram, seems to be also contributing to poor performance, feelings of poor performance, and attitude changes toward our sport. There is not a lot of work that has examined social media and social comparison with respect to burnout. So I do think that this is an area of research that's going to grow since we see many of our youth and young athletes frequently on social media. So with these causes in mind, it helps us then understand early warning signs of burnout. So one early warning sign that we should be aware of is that we're fatigued after rest. So this means we have to understand like the proper amount of rest. So having a background in physiology would be helpful to understand how much rest do I need after a hard training stint. But one thing that I often tell people I work with, to my students in class, I tell them a really great way to help us understand if we're recovering is to use our resting heart rate. And many people now have smartwatches that might attempt to do this. To get the best read of our resting heart rate, you should be wearing then your watch at night, because to get a good understanding of your resting heart rate, you should take it right in the morning before you sit up, before you drink coffee. So your alarm goes off, turn it off. If you woke up, with a startle, take a moment, and then take your heart rate for a minute. Get your resting heart rate, and you want to do that for a week. That's a typical week for you. So you didn't run a marathon, you didn't have a big training session, you didn't stay out all night partying. Like a typical week that's normal for you, and get your average resting heart rate. And if you see, and then track it. And if your resting heart rate one day is like 5 or more beats higher than it normally is, that will indicate to you that you haven't recovered from the day before. Our resting heart rate change, it's variable, like 1 to 2 beats here and there. But if it's 5 or more beats, this tells us that we haven't recovered. So that you should take a rest day or back off in your training. It's a really good way to realize that we need to rest more, because if we don't rest, then we compound our exhaustion. This could contribute to burnout. We also know that changes in one's mood can signal that we may be burning out. So this is, I might be quick to anger, more so than normal. I might be quieter, or seem sad and more depressed. This also then will impact our relationships and how we talk to others. So we might be quick to anger and get mad at our friends or or our coaches or our parents. We may withdraw and not hang out with our friends anymore. But we see changes, and these changes are bad. We also see ongoing performance declines. We all will suffer once in a while from a slump, but ongoing performance decrements could signal that we're not recovering, and that we may burn out. We know that if someone indicates to you that they're having trouble sleeping, it could be a sign for burnout, because we have seen in longitudinal work that sleep disturbance is linked to burnout. We also know if we're not sleeping well, this impacts recovery. And stress can impact our sleep. And so you might want to probe a little bit more about if you're having trouble sleeping, is this because we're highly stressed? If you notice changes in motivation, so if you're a parent, you might see that your child no longer wants to go to practice or is trying to avoid practice. You see changes in how we talk about sport, that we don't enjoy anymore. It's not fun. I don't like it. I don't get anything out of it. That can signal that motivation might be changing, or our why for playing. And then finally, a more clinical assessment would be cortisol. This is a way I think the field is going. We're trying to understand biomarkers of burnout in workplace burnout and athlete burnout. The most commonly studied biomarker is cortisol. The hard part about cortisol is that it fluctuates throughout the day. So we do need to have specific time points that we're measuring it, and measuring cortisol multiple times to understand if it's contributing to, if we are experiencing burnout. But cortisol is our stress hormone. So if we have high levels of cortisol, it usually indicates that we are stressed, and this could be an early sign of burnout. So with these early signs, it's important that we are aware of them so we can try, because if we aren't aware of them, we don't take steps to reduce burnout. We know that there are quite a few consequences associated with this syndrome. So what we've seen in research within the sport context is that if someone has greater perceptions of burnout, they have lower engagement in sport. This means that my confidence and my vigor and my dedication goes down. I may withdraw. or quit. We see changes in decreases in performance, and we also see that our quality relationships go down. And that usually stems from the fact that my mood changes, my communication is changing, and I can be upset. Outside of the sport context, we also now can study physical and mental health. In the last 10 or so years, there's also been a big push in research to assess what are the consequences of burnout outside of sport. Yes, it's upsetting that if we burn out, we might not engage in sport, and that our performance decreases. But what happens outside of the sport context? And so we're now beginning to study physical and mental health with regard to burnout in sport, and we see that higher burnout is associated with higher depression and higher anxiety levels and lower subjective well-being, which includes life satisfaction. I often get a question about burnout and illness. We don't really know. The research is inconclusive. We have found some work that has a positive association with physical symptoms and illness. And what I mean by physical symptoms is pain or chest pain, headaches, dizziness. An illness is being sick, fever. So we've seen some positive associations, and then some work has had no association. So this is something that we need more research on. And I think the hard part with this stems from not having a clinical threshold for burnout. So we don't have that clinical threshold, and the lack of epidemiological studies, then it's hard for us to say who is truly burnt out, and then assessing their illness and their physical symptoms. A lot of our work with burnout are with people who might have lower levels of burnout, because our true burned out individuals likely have left sport. So one thing I did want to then talk about today is the trajectory of burnout. So if we know these early warning signs and these causes of burnout, and the consequences of them, a good question is, well, if I experience it during the season, will it go away? And the answer is maybe. We don't really know because we don't have a lot of longitudinal work that has studied people over multiple seasons. And that stems from it's really hard to get access to youth athletes and professional athletes and follow them across many seasons and have a large enough sample to then do quantitative analyses. But what we do know is that burnout does tend to increase across the season. And we have very limited work that's assessed the trajectory of burnout. But there's one key study that I wanted to point out. I think it's one of the only studies that has looked at a trajectory of burnout. And this was in 895 youth handball athletes. And they measured burnout at 2 time points every year. And what they found was that in this large sample of adolescent athletes, that exhaustion increased from age 14 to 16, and then saw a small decline from age 16 to 19. They saw a linear trend, decreased trend in reduced accomplishment. And so feelings of inefficacy actually decreased from age 14 to 19. So that would be good. It's a small change, but we do see that athletes are actually seeing a decrease in this symptom. And I'm not showing this on the screen, but they looked at differences between boys and girls, and they did see a sharper decrease for girls, meaning girls had a perception that they were doing, accomplishing things in sport as they aged. And then for sport devaluation, they saw also a linear trend where from age 14 to 19, sport devaluation increased. And again, they looked at differences between boys and girls, and they saw girls had a sharper increase than boys. So what this tells us here is that youth athletes they devalued their sport more as they got older. which also makes sense as we think about kids as they age. Sport may become less important because I'm doing other things. So overall, what this research showed us is that the three dimensions of burnout seem to change differently across time. So within a season, they might build together, but across time, at least with this one study, we did see that there was a different trajectory for all three dimensions. Another common question I get about is about coach burnout. Coach burnout is defined slightly different than athlete burnout because it's workplace burnout. For sake of time today, I won't go too much into coach burnout, but the limited work that's examined coaches over more than like one season has found that once burnout is experienced by a coach, it seems to be a bit of an enduring state where it lasts at least 6 months to a year. And so that's also alarming because that tells us that if I experience burnout as a coach, if it lasts longer, that means it's going to impact my behaviors with my athletes longer. And research has shown us that if our coaches' behaviors change, that can actually then impact athletes' burnout and as well as their actual time on their sport team. Okay, so with all this information, what I wanted to end with then is how do I reduce risk of burnout? So I'm going to present to you some strategies for athletes and then some strategies to think about with respect if you're a coach. So one way to do this is to make sure that our athletes are getting adequate rest and recovery, and particularly thinking about our sleep routine. We should be shutting off social media before we're going to bed. We should not be having screen time. And so if you're an athlete or a parent, I would highly think about like nutrition, what you're doing outside of sport, and then also how can I improve my sleep routine and my sleep to help me recover. We can use cognitive reframing to help change perfectionistic cognitions. So that means how I'm thinking as a perfectionist. This can be done like as an individual, or we can get help through cognitive behavioral therapy. But when I talk to athletes, I often have them start writing down their thoughts, and then we work to change those thoughts to help reduce concern over mistakes or reduce pressure thinking that I have to be perfect. And so I often like to couple cognitive reframing with goal setting, because as a perfectionist, we might be setting too high of goals. So we need to reevaluate our goals. But at the same time, goal setting can help us and help athletes see that they are achieving things in their sport. So if we only focus on an outcome, so going to the state championship, winning the state championship, getting to that goal is very hard. And so if we set meaningful goals, so process and performance goals throughout the season, this can help us see that we're achieving things in sport. It might also help us then evaluate our perfectionistic tendencies. I highly recommend trying to decrease co-rumination with teammates. This co-rumination means excessive problem talk. So some of my research has examined co-rumination amongst teammates, and it is a direct contributor to burnout. It is also linked to depression and anxiety. However, it's an indicator of good quality relationships, especially for girls. So we tend to talk excessively about our problems because it means that I have a close friend and we're going to vent about this, but then it also can lead to these mental health concerns. So we want to think about what we're talking about and maybe perhaps decreasing co-rumination, or at least trying to find a way to solve the problem that we're ruminating about. We want to try to also seek out social support. That can be from a teammate, a parent, or a coach. But we know that social support, if I perceive social support, it will reduce our burnout risk. We want to think about our why or our motivation. So if we find that we are going to our practices because we have to, I recommend thinking back as to why we first started playing our sport, and also considering what you value about your sport. Perhaps it's the health benefits, perhaps it's that you get to socialize with teammates. But finding a why over that's more than just I have to go because I'm told I need to go, or because I've always gone. And then finally, I saved mindfulness for last because we have very few empirically based interventions that have been done to assess if we can reduce burnout. And one intervention did use mindfulness. It was a very short, I think like 3 to 5 day mindfulness intervention, and it was found to reduce burnout in a case study of an athlete. So I would recommend implementing mindfulness into an athlete's routine. You can start off very short, 10 to 15 minutes, once a day, 3 to 4 times a week. You can use apps such as Headspace to help individuals work through like mindfulness meditation. We also know that exercise that uses a mindfulness-based component, such as yoga, could also be very helpful. On the flip side, if we're besides individual strategies, there's quite a few strategies that coaches can implement, and I'm just going to touch on a few. As a coach, we want to encourage athletes to do more than sport, or at least give them the opportunity to consider doing more than sport, or be open to them participating in more than one sport. This has become hard with the professionalization of youth sport, but we want to encourage athletes to explore their identities, especially our youth athletes. We need to be aware of stressors outside of the physical training environment. So this entails academics and social relationships. Thinking about collegiate athletes, we want to consider like finals and when school stress ramps up, because stress is a leading contributor to burnout. So we want to try to understand what athletes are going through to reduce other stressors. We also want to be cognizant of how our verbal and nonverbal communication conveys messages to our athletes. A lot of communication is nonverbal. So you, by what we don't say, by the looks that we give, or if we don't talk to athletes after they perform poorly, that indicates then that the number one thing we're looking for is good performance. And so that connects to the next bullet point of thinking about the climate or the environment that we foster. There's a place for competition, but there's also a place to help athletes understand that improvement is important relative to their own past performances. And then finally, I'll leave you with you want to monitor training and recovery. Each athlete is individual. And so it's very hard to individualize training when you have a lot of athletes. If you have 20, 30 athletes on a team, but sometimes some athletes will need more recovery than others. So I would recommend implementing like the baseline heart rate testing to at least give yourself strategies to assess recovery. But with that, I will hopefully wrap up and take any questions. So thank you for listening.
So much, Chrissy. That was actually really informative. And we've got some questions too that I think are actually really good and might be able to underscore some of your points and sort of expand upon them. So this question comes from Mary, and she says, how can we or do we reset youth sports culture to decrease like the intensity of it and the length of it? You know, like there are a lot of sports that have switched to sort of a year-round model. You know, is that advantageous? Is it not? Can you give us some sort of culture bits we might be able to find too?
So this is a question that we ask a lot in our academic community, and people have different opinions. And I think it will take a very large culture shift because there's so much money in youth sports now, and so it does need to reset. We need to have we've seen a decrease in recreational opportunities or low cost opportunities for youth. And most of the opportunities available now are intensive and cost more money. So I think I don't have the right answer, or this is how we do it, but there needs to be a reset, and it will take more than I think it takes like the whole community to reset. I think the hard part with that too is since there is so much money in it, you have to take a lot of buy-in from people and from various stakeholders. if we change the youth sport culture, people are going to lose money. Yeah.
There, in fact, a question came in at pre-registration about the added pressures from the NIL and the portal,
Yeah.
sort of adding to the high stress, that students particularly might feel.
Yeah, we had a debate. I had my undergraduate students have a debate about NIL and the transfer portal. And we talked about team cohesion and culture. There's very little research because NIL is so new. But there's, I think, pros and cons to it with regard for athletes, and but there is added pressure. So if people know about NIL, like athletes cannot be paid to play. So they earn their money via other ways. But if you think about who obtains the NIL endorsements, they are our best athletes. And NIL endorsements can be changed after a season. They can't be changed in a season, but they can be changed after a season. So if your value goes up, great, but your value might go down. So I mean, that is definitely an added stressor on our athletes in the collegiate sphere. And then if you add on top of that, now there's pressures and stress of figuring out how to handle our money that we might not be able to deal with. Yeah. Mm-hmm.
I think sort of coupled together, being young with the added stress of a sport plus money management, I would imagine that's a big ball of wax for a young athlete.
Well, I know there's some resources now. I was perusing for high school athletes, because if you're 16, 17, you're beginning to think about college and if you're going to pursue collegiate athletics. And so if you're a parent watching and you have a 16, 17-year-old individual who's thinking about participating in collegiate athletes, you should familiarize yourself with NIL and rules and regulations, because they differ. So there's NCAA rules, but then there's state rules, and then there's also conference rules. So you really want to be informed before you start talking to people.
That's really good information to know. I didn't realize there were sort of several layers of rules and regulations that a student would need to abide by. Again, its own point of stress, I would imagine. Yeah. Got a couple more good questions here before we wrap up. This question comes from Robin, and I think it's really important. Is burnout essentially inevitable? The cycle in the case, the end of a long season versus the end of a long semester, particularly if you're like a professor, a coach who's also a teacher, or is that different? Can you give us an example?
Yeah, I would say I don't think it's inevitable. I think maybe so the three main components of burnout are like symptoms of burnout. So you might have one of them, but you might not have all three. So I think about, like, for faculty right now, it's finals week. So I think many people are feeling some level of workplace burnout, but it might not be full-fledged burnout. And it's probably mostly the exhaustion piece. And a lot of research that wants to touch on burnout will look at the exhaustion piece, because that is a key marker. But I don't think it's inevitable at all, especially if you have set in place like coping resources. So if we learn to cope better with our stress, if we can remember our why for playing sport, enjoyment. So if we're intrinsically motivated or have a motivation that is higher quality, so internal reasons for participating, that can stave off burnout. Mm-hmm.
Also, like, kind of a useful skill for especially young athletes to develop, that's balance. That's sort of managing, the heavy with the not so heavy. I think those are things that grow as you grow, but a good foundation.
Well, especially, what we apply in sport can be applied outside of sport. And so there's a whole body of work that looks at workplace burnout. But many of the same causes of burnout are in work as well. And again, leading contributor is stress. And so if we can learn like proper stress management techniques, that can help us in all contexts. And so again, I think we all might experience maybe a symptom or two, but might not become full-fledged burnout, especially if we have the tools to help recognize that something's happening. And then I need to, use that tool, whether it's more rest and recovery. Is it helping me manage my schedule more? Is it changing my goals, whatnot? And then it might help us reduce our perceptions of burnout.
Excellent. Great. And then one last question before we wrap up. And I think this is a really good one. This also comes from Robin, and she uses loneliness and sort of isolation or alienation. Could that sort of, maybe coupled with another thing, equate to, being another dimension of burnout? I mean, I think about young people, and I think young people are maybe more inclined to alienate themselves or be alienated by a group. Can you talk about that a little bit?
Yeah. So in sport, so loneliness has been looked at outside of like the sport context. And most of the work that has looked at loneliness has looked at in or out of sport, and then does loneliness perceptions differ? And thinking like this sport buffer, right, help us not feel lonely. But my most recent work has looked at loneliness specifically in sport, because we might be on a team, but we can still be lonely, right? Because loneliness is different than being alone. And so the study I shared, we did look at a fancier model, because some people might say, does burnout lead to loneliness, or is loneliness a precursor to burnout? And our work supported that loneliness is like a predictor of burnout and not the other way around, which then to me says we need to consider like team dynamics, and like what is actually happening on a team. We also can study loneliness in, like globally, and then like so overall loneliness versus feelings of loneliness in sport or at home. I think that would also help us better understand like how this perception is impacting burnout. I don't know if it's to answer the question, if it's another component of burnout, but it needs more exploration, I have to say. Like with loneliness and burnout, I think the only studies I can think of are mine. So there's 2 or 3. So we just need more work to really understand this. And in general, with mental health concerns with respect to burnout.
That was a good answer. I think that brings us actually to about the end of our time. Thank you so much for being with us, Christine. We really appreciate you being here. For our viewers, if you're interested in viewing this again or sharing this with your network, you can catch a recording of this webinar later today at alumlc.org/MiamiOH. And if you have any other questions, please feel free to reach out. Thank you all for joining us, and love and honor. Have a great afternoon.
Thanks.